Hello and welcome. My name is Dr. James Cellini. I'm a board-certified veterinary neurologist, and on today's episode, we're going to talk about vestibular dysfunction in dogs and cats. Today's episode, we're mainly going to be focused on what vestibular dysfunction means and what it looks like symptomatically in dogs and cats. So what vestibular dysfunction is, it basically refers to a disruption in the balance system in the brain, the vestibular system. So what that system is, in very broken down terms, is a system comprised from structures in the inner ear connected to the brainstem by a nerve called the vestibular nerve. This nerve is a one-way street that sends sensory information from the inner ear to the brainstem, and from there, information is relayed to the brain and the spinal cord. And what this system does is it operates in both left and right sides. There's a left and right ear, obviously, and left and right nerves, and everything's left and right sided. But together, they send opposing signals to each other, the result being you and any animal is able to walk on the straight and narrow. Your head maintains a neutral position to the ground and relative to gravity. You're able to walk without leaning to one side, and you basically have normal balance. When the system gets disrupted in pets, you can see a myriad of symptoms, but some of the more common symptoms that you would see would be things like a head tilt to one side, possibly a rhythmic eye movement called a nystagmus, as well as an altered gait called a vestibular ataxia. That just basically means an incoordination to their gait. Sometimes dogs and cats will show what's called a strabismus, where one eye will be positioned kind of awkwardly. That's kind of a softer finding, so I prefer to focus on the other three. Now, how this is different from a seizure is very important because seizures and vestibular dysfunction arises from different problems. They need different treatments, and there are different parts of the brain that are affected. A seizure comes from the front of the brain, whereas a vestibular problem comes from either the back of the brain in the brainstem or in the inner ear. So let's get into some examples of what vestibular dysfunction looks like in a dog and a cat so that you can be aware of what to look for should this happen to your pet. And as always, these videos are meant simply to educate pet owners as far as what to look for and what symptoms may represent vestibular dysfunction. If you see these symptoms, please refer your pet to the nearest veterinarian, either your primary vet or a 24/7 emergency hospital if it's after hours or holidays. Okay, so what we're seeing in this dog is this. If you look, we'll go ahead and pause the video. So if you look at this dog's ears, that's a great way. I mean, you can obviously tell this dog's head is tilting to one side, but when we talk about a head tilt, kind of an objective way to look at it is to draw a line over the crest of their ears. Now, different dogs will have different ear positions and different kind of conformations to their ear. But what we're seeing here is that if you draw a line from here to here, you see like the arrow just goes off in one direction, right? It goes like this. Whereas a normal head position would create ears that have a line going parallel to the ground, right? I can't do it exactly with my mouse cursor, but you get the idea. So we've rotated our head a certain number of degrees, I'd say maybe like 80 degrees or so in this dog, to the dog's right. When we speak in terms of left and right, we always speak in terms of the relation to the dog, not you. But this dog has a head tilt to the right, and you can see that by looking at it again. Draw a line from ear to ear and then see where that goes in relation to parallel to the ground. So that's one sign that this dog is exhibiting a loss of balance or vestibular dysfunction. Now, the other thing may be difficult to tell, but you see the eyes. See the eye, boom, 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 boom. You see that rhythmic oscillation back and forth. The eyes are drifting to the right and then they're snapping to the left. It may be difficult to tell. Let's go back to that part again. You see that? You see how they drift to the right and then they snap to the left? So that is what's called a nystagmus. And that just means a rhythmic twitch of the eyes back and forth where there's a slow phase and a fast phase. And that is another hallmark sign of vestibular dysfunction. So this dog is displaying a head tilt and a nystagmus. Okay, so right off the bat, we're thinking this dog's vestibular. Now, an important thing to review with this dog too is notice how he's responsive to his owner. He's looking around, he's clearly conscious. The owner's talking to him and he's looking at the camera. So this dog is not having a seizure, at least a grand mal seizure, okay? So this dog is maintaining his conscious state. He's simply off balance and has an equilibrium issue, which is obvious. But he is conscious, he is alert, he's responsive, and that's because the whole part of his brain that controls that stuff is not affected. He simply has a balance dysfunction. So it's kind of a good neuroanatomy lesson. So now if we watch this dog try to walk around, what we're going to see is what's called a vestibular quality ataxia, meaning you see how he's constantly kind of drifting to the right? He's kind of scared to walk because he knows he's going to start falling. But notice how his head is leaning to the right. That implies that his body is going to want to go to the right as well. And yep, as usual, the buddy has to come see what's going on. All right, he tries to walk and he drifts. He keeps getting pushed to the right. His body keeps wanting to push him to the right. Now let's stop and talk about this for a second. So why is he being pushed to the right? Why is his head tilt going to the right? Well, I can't know for sure because I don't have him in front of me. I didn't do his exam. I'm not his veterinarian and all that. But suffice it to say, in most cases, again, this is not an official diagnosis, but in most cases, what's happening here is the right side of this dog's vestibular system, let's just say the right nerve or the right inner ear or the right side of the brainstem, is not working correctly. It's not working as well as the left side. So an intact left side is going to push you to the right because that's how the system works. But it's pushing you unopposed. There's no push back from the right side. So when your right side's not working, you're going to be pushed towards the right side. Your head, your body, everything's going to just lean that way. And until he figures out and heals from whatever has caused this issue, he's going to lean towards the right. So his right side is, again, very much emphasis here, probably, but his right side is probably affected. Again, big disclaimer, there's a whole slew of issues that could make me wrong and can make this look like a right-sided issue and it not be, but in most cases, this is going to be a right-sided brain, nerve, or inner ear issue. And that's because everything's going towards the right. You see how it's like there's an invisible hand pushing him to the right. And he's trying to walk. He's got enough strength to stand up, but he's very uncoordinated and he's very wobbly and he's walking like he's drunk. Okay? So this is very different from a seizure. We didn't see any of those seizure dogs trying to walk around, right? And then there's a great shot of his nystagmus. Boom. Oh, left, 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 left. Now let's get into an example with a cat here showing pretty obvious vestibular signs. So let's start from the beginning. So the first thing we're going to notice with this cat is its nystagmus. So see that? Boom. Now this time the fast phase is going to the right in this cat. So you'll notice if I restart the video, you'll see his eyes will drift this way and then this way. Boom. So left, right, just like that, okay? So we'll watch it again. So that's a nystagmus. Now it's happening we call it a horizontal plane. It's happening in that direction. So we call that a horizontal nystagmus. You can see it's very obvious with this cat. So one rule of thumb, again, this isn't 100% either, but one rule of thumb is you take the fast phase, meaning the jerk, it kind of jerks to the right in this case, boom, 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 to the right. A lot of the time, the problem right off the bat is going to be the opposite side of that fast phase. We say that the fast phase is away from the lesion or away from the problem. So in this case, the fast phase is to the right. right off the bat, we're thinking, well, in most cases, the problem's going to be over here on the left side somewhere. But again, there's a lot that goes into the exam that could prove us wrong in that regard. That's just a very broad statement, not 100%. Here's a video of a cat showing some of the gait disturbances that we can see with vestibular dysfunction. So let's start the video. We'll see right off the bat, this cat's just a little bit unsure of himself. We see him kind of wobble like that. It's really quick, but you see that sway. We call that a truncal sway. That can sometimes be a very subtle sign of vestibular dysfunction in a cat. Cats are notorious for kind of doing that little sway right there. So let's play it one more time. Watch him stop, and then he'll sway. See that? That's a truncal sway. And then now he's taking a couple steps, and he's falling over. So he fell over to the right that time. Caught himself and just kind of plopped down. But that's pretty typical. That's what cats will show you a lot of times when they're having issues with vestibular dysfunction and difficulty with their balance. That's a good example. Okay, so you saw a couple examples there of vestibular dysfunction in dogs and cats. In future videos, what I'd like to do is go through the possible causes of these symptoms, treatments, how we can address some of these issues, what things to look for would be maybe more dangerous than others, what things are life-threatening, what things are not. But for now, I think getting a good grasp of what this problem looks like is a good starting point. And in future videos, we'll focus on diagnostics and treatment, prognostic indicators, things of that nature. So I hope you enjoyed this video. Please hit the like and subscribe button if you'd like to see more videos from my channel. As always, I greatly appreciate any comments you leave, and I can't wait to give you more videos and educate pet owners further in the future. Thank you very much.